So let's take you to this conversation now as Breast Cancer Awareness Month is marked in October. Health experts have raised concern that there are too many mammography units, especially in rural areas and public health care centers. Experts now say breast cancer is increasingly affecting younger pre-menopausal women in the country. For more on this now, we're joined by Aluta Hadi, who's a cancer survivor, and Professor Bernado Rapoport, who's a specialist physician and medical oncologist. Thank you so much both for your time on the program. Perhaps let's start this with giving it a human feel. And Mrs. Hadi, let's start with you perhaps. Can you take us back perhaps to the moment where you were diagnosed?
All right, so thank you so much, Ayanda, for having me on the show today, and good morning to all the viewers. So I was diagnosed in 2018, and I was actually 28 in that year. I never imagined that this could actually ever happen to me, but it actually did. So what happened with me was that I actually got diagnosed in July, but I actually started feeling a lump in my breast around late January, early February. And then I obviously went to Dr. Google to actually check what could this lump be. And Dr. Google actually told me that in terms of my age, ethnic background, I should not even think of actually having breast cancer. So I actually concluded that it could have been some sort of cyst, and I let it go. And then I continued with my life. But as months were actually going by, I could actually feel on my breast that this lump is actually getting bigger. And when I touch on it, I could actually feel that it has a bit of pain. I go back to Dr. Google, and Dr. Google tells me that a lump actually is not painful. It's painless, so I ignored it and decided that it could be a cyst. But as much as in my heart of hearts, I told myself that this is not breast cancer, I still wanted to go and have it checked out. So in my mind, all I knew at that specific age was that I most probably need to go just do a mammogram. But now the question is, where do I actually go? I literally had no idea where to go. I had no idea where to go. I would actually go on Google, check where can I actually do mammograms, and I literally could not find any answer. And I didn't even want to go back to my doctor because earlier in the year, I had my annual pap smear and I did have, a breast examination and nothing was picked up. So I actually wanted to go to the source. Anyway, I just let it go, continued with my life. And then one particular day, it was quite a random day actually. I was coming from the pharmacy, and funny enough, this pharmacy is right opposite where I stay. But for some reason, I never noticed this specific clinic until that day. So as I was walking out of the pharmacy, I see a breast and bone density clinic. I'm like, oh great, let me actually come into this place and inquire on if I can be able to do a mammogram. When I get there, they tell me, they ask me how old I am. I told them I'm 28, and they asked me, why do I want to do a mammogram? I told them that I'm feeling a lump in my breast, and they told me that due to my age, I'm unable to do a mammogram. I would need to come in and do an ultrasound, but I'd actually need a letter from my doctor. I asked them, well, since I'm feeling the lump, can't I just come directly? For me to start at the doctor, get a letter, whereas there's something that I'm feeling. And then they said, I can, I just won't have to claim on medical aid. I'll just have to pay cash.
Yeah, and I think, sorry to have to rush you through that, because we also have the doc as well, because I just want us to bounce ideas off each other. By the way, you with Mkolisi in studio, understandably so, because you're used to chatting to Ayanda around this time. So maybe let's bring you in, Doc, and just find out just how important is early detection, perhaps on the front of just knowing that if perhaps maybe a woman like Mrs. Hadi here, detects a lump, just how important is it for her to have it flagged, but also just make sure that it gets the important attention that it deserves?
Early detection is super important. The later you diagnose the breast cancer, the more advanced the disease could be. We see patients, even young patients like the one that is on the interview with us, that they don't come to treatment, detection, or biopsy, or whatever, and then the disease is more advanced and the chances of long-term survival goes down. So early detection is super important. That's what the message that we have to give to everyone. Self-breast examination is very, very important. And then consult a specialist or consult specialized units is also important because sometimes underscore the importance. African patients, young patients, is also very common to have breast cancer. And we see a lot of patients. I'm part of a multidisciplinary team with Professor Ben and her team, and we see a lot of patients with early breast cancer that they end up having problems because it's not diagnosed early enough.
Yeah, and just on that front, you know, we are looking at the communities that are serviced in South Africa. You know, a large chunk of them are not able to get what many call quality health care. They don't have access to facilities such as your specialists, as well as those oncologists who actually assist to make sure that this early detection happens in a way that it is supposed to, you know, happen. Talk to us about some of the efforts that you think are on the table that might be assisting these women in some of these communities to ensure that they get the health care that they need. Because realistically speaking, we are speaking to people who, most of them can't even afford proper medical care.
Look, that's a problem, but in my opinion, a breast self-examination is always very important, and to consult a general practitioner or a doctor is super important also. And then to emphasize, are you sure it's not breast cancer? Are you sure it's not a malignant disease? Because I don't want to be diagnosed when it's late. It also, from the cost-effective point of view, is much more easier and, let's say, cheaper, or let's say less costly to treat patients on early stage. When the disease is in late stage, when it's there, it's much more difficult to treat, and it's also more costly. So for the authorities, it's important also to be very well aware that late detection, it doesn't lead to good outcomes, and also it costs a lot of money on the healthcare systems.
And Mrs. Hadi,
so to be able to these efforts, I want to mention, I mean, to me, to do a self-breast examination, to consult a doctor, and to be referred to a hospital, I think should be the pathway, at least to see, and then to insist the women to have a ultrasound of the breast or a mammography. I think is very important also.
And Mrs. Hadi, you know, you talk about that poster, which I would like to call perhaps a silver lining in it all, you know, a shining beacon of hope for you that you might still be able to get treatment, right? Talk to me about that process, and was it friendly, and talk to me about the perhaps cost implications, if there were any, because we do understand now that there are facilities that are made available to ensure access for all.
So luckily, I had medical aid. In the beginning, I was actually told that I might need to store my eggs. So I never had money for that. I never budgeted at age 28 that I might not be able to have kids. So I just decided that, oh, well, I'll skip that and just straight to treatment. So I went through chemotherapy for about 6 months. And as much as medical aid did cover, you must remember that I obviously cannot go to work as I was. So obviously through that, there had to be other means, and luckily there were, you know, certain policies that were in place that were able to cover a certain percentage for me to be able to, you know, still continue paying the things that I was paying for at that specific time. So I went through chemotherapy, I did surgery as well as radiation as well. And obviously, I had to keep seeing my doctor. There were blood tests. There's quite a lot that was actually going on. Majority was paid by my medical aid, and then other payments I had to make by myself.
And let's bring in the prof again on this one, Doc. You know, I think it would be important now to also place a spotlight on some of the treatments that are available, as well as the various options that women can explore when they've picked up a lump.
Look, the number of treatments, it depends on the cancer subtype. Some of them, we divided usually on probably for practical purpose on 3 different subtypes. Those ones that are hormone sensitive that you can treat with antihormones. Or let's go back one step. Most of the patients, if not all the patients, are treated with surgery, and radiation therapy is also required for the majority of these patients. But from the medical oncology point of view, you can have 3 or 4 different types of treatments. One is anti-hormones that is available to the majority of the patients. Those treatments are not expensive. Then you have chemotherapy, which is a conventional chemotherapy that the patient was referring now, the lady here that is talking with me on this interview. And then you have also immunotherapy that is used for the treatment of patients with triple-negative breast cancer on early stage. That treatment is incredibly expensive. It costs like 1.8 million rands, so most of the medical aids, let alone the state patients, the medical aids, they don't cover such treatment unless you're on one of the very fancy plans of the likes of Discovery. And then you have also targeted therapies, like use for if the tumor is HER2 positive. There are 2 drugs that you use in that setting. Trastuzumab now is biosimilar and is probably available to most of the patients on the medical aids. And also in some the state hospitals. There is a second drug that increases the outcome called pertuzumab that is not widely available because it's not as expensive as immunotherapy, but it's also expensive and it costs a lot of money to treat those patients in the order of the entire treatment of probably 500,000 rands or somewhere around there. So unfortunately there is not all the treatments available, but in South Africa we can treat a lot of patients quite successfully with all these treatments available also. Let's put it across like that. The other thing that is very important that was mentioned is the issue of the oncofertility, that I personally think is a human right, and a lot of the patients are not covered by the medical aids as it was described by, what is your name? Sorry, I missed your name.
That's Mrs. Aluta Hadi there. And I'd also like for us to perhaps also, because there's been some questions. Yeah, there's been some questions as well on our social media platforms where, our viewers also would like to know, how do they know a lump is possibly cancerous, or can a lump be non-cancerous as well? Maybe is there some sort of a feel or different feel to the different lumps?
Look, it's very difficult that for the public, because some of the doctors even it's difficult to know. But if you have a suspicious lump, you must go to your doctor and definitely, to insist that you want to make sure that it's not breast cancer. That's what I would do if it would be me or my wife or somebody in my family. The way that we do it, then to do like ultrasound of the breast or mammography or both, and to make sure, because early detection improves the outcome. That you don't want to. We see patients. We see a lot of patients, and we see young patients like that they come late, or they come with a disease more advanced, or they made mistakes. That they said, well, it's nothing. Like they say to her, don't worry about it, and then the tumor keeps on growing. That's unfortunately the situation.
Yeah.
So. Awareness, look, it's the month of awareness. Awareness is super important. You must make sure that you don't have breast cancer. That's what I think.
Yeah. And Mrs. Hadi, we're wrapping this conversation up. Let's just hear from you, your parting shot, and what would you say to other women out there this Breast Cancer Awareness Month who might be grappling perhaps with a similar situation, but also now maybe could be at a stage where they've just picked up that they possibly have a lump?
To those that have picked up a lump, as Dr. is saying, have it checked out. Do not be like me, where you would want to know what type of lump could be what. Rather have it checked out, because when I checked out my lump, I actually had more than one lump. So imagine if I ignored it and think maybe it was something else. Most probably I wouldn't be here today. And to everyone that is actually going through breast cancer, one thing I can tell you is that this journey is doable. I personally did it. It wasn't an easy journey, that I will say, to the point that if I had to go through chemotherapy again, if I could, I would decline. But one thing I can tell you is that you will get through it. And one thing I should also mention is have a cheerful heart. When I say have a cheerful heart, there is a verse in Proverbs that says a cheerful heart is good medicine. And that is what kept me, through the whole journey. The journey is about, over a year in order for you to fully recover. But being cheerful and knowing that, this is just a phase, this will pass, and just trusting in God, that you would be healed and you will be fine. So yeah, that's me.
All right, and look, we wish you all the best then. Thank you so much for coming onto the platform and sharing your story with us and sharing your story with South Africans there. That's Mrs. Aluta Hadi joining us there. She's a cancer survivor, as well as Professor Bernado Rapoport, who's a specialist physician, medical oncologist. Thank you so much indeed for your time and insights on the program today.